directives from seniors, and we really talk to individuals. We look at community issues and see what's systemic and what needs to be changed at a legislative level, and we work towards those goals as well. But we really take all of our direction from seniors and the issues that they're facing in their communities. We have several different programs that we do. One of them is the Patient Rights Helpline, and that is for anybody who's experiencing any kind of a patient rights issue. If you know somebody who's in the hospital, if they're having discharge issues, they don't know where they're going, they don't feel comfortable with being discharged, maybe they don't understand their care plan, or they don't understand if they're observation or not, we can absolutely help with that. If they're in a nursing home, if they have quality of care concerns, if they have visitation issues, we had a lot of that during COVID. Absolutely, they can call us and we'll help them. We'll refer them to the agencies that can help them in the immediate situation, and we'll also help them to make a better plan long term. I had somebody who was in the hospital, was all ready to be discharged to rehab, and then the insurance said she walked too many steps in the hospital and they wouldn't send her to rehab. So she got discharged to home, and was caring for her elderly spouse as well. So they called us and we were able to help them navigate that system and get her the care that she needed, which was wonderful. We do also have the Managed Care Counseling and Assistance Program. This is a lot like the HICAP program, if you've heard of that, like what your local Office of the Aging does. It's free, unbiased Medicare counseling. You can do this any time of the year. So if you ever have questions about your Medicare coverage, maybe you're new to Medicare or you know somebody who is, they can call us. We'll walk them through the entire process. Open enrollment's coming. We're going to talk just a little bit about that to let you know the dates. But you can call us during open enrollment and we'll do free plan comparisons for you. So we'll do like a plan comparison of your plan and 2 others. So you can just see what the options are. New plans come out every year. There's new pricing, there's new things that are always available. So it's always good to check your coverage and just make sure that what you're getting fits your needs the best that it can. But anytime during the year, if you have a question, feel free to call us and we're always happy to assist you. And it's always free and unbiased. We also have the Senior Medicare Patrol, or SMP program. We are the federal grantee for New York State to deal with Medicare fraud. So we have a grant from the federal government and we help everybody in New York State to prevent, detect, and report Medicare fraud. So this could be anything from somebody calling to try to scam your Medicare number to maybe you got double billed. You had a question about whether or not something was legitimate, like an ambulance bill. We'd help with all that kind of information. And even if you think it's just an error and you think it was just a mistake, humans make mistakes all the time. We still encourage you to call us and let us know about it so that we can get it reported and taken care of. If it is fraud, we work with the Office of the Inspector General, so we can refer cases to them for further investigation. And we'll keep that case open for a year, say in the instance of compromised Medicare numbers. So we'll follow that, we'll help you report it, we'll help you keep an eye on it and make sure that we fix anything that goes wrong. So like I said, we're going to talk a little bit about a couple of the parts of Medicare, just so that you can really understand all the benefits of the Medicare Savings Program, because it does help with a few parts of Medicare. So just to start off, I know most people know you can get Medicare when you turn 65. You're eligible the 3 months first your birthday to sign up, the birthday month, and the 3 months after in your initial enrollment period. But you can also get Medicare if you've been on SSDI disability for 2 years, 24 months. If you have end-stage renal disease or need a kidney transplant, or if you have ALS. So just be aware there are some other circumstances people can qualify for Medicare. So not everybody is 65. Generally speaking, if you or your spouse has worked for 10 years, you do get premium-free Part A, but there are situations where somebody might need to buy into Part A because they don't have that work history. That is an option. And there's things that can help with your Part A premium if you're in a situation where you did have to buy in and pay for Part A. Most people do get it for free. So enrollment in A and B is always done through the Social Security Administration. So you contact them, there's information on their website, you can apply right online for A and B. And so this is what we talked about with the initial enrollment period. This is when you're first eligible for Medicare. You get this time frame to sign up. This is completely separate from open enrollment. So if you're just coming into Medicare eligibility, this is what you would go by, not open enrollment. Open enrollment is if you've already had Medicare. But again, if you have any questions, feel free to call us. So the Part B premium is a monthly premium. Generally speaking, it's deducted right out of your Social Security benefit. In 2022, that's $170.10 every month that comes out of your Social Security for Part B. If you have a higher income, if you make more than $91,000 as an individual or $182,000 as a couple, you may pay a higher premium for Part B. And that's known as IRMA. So if you have that situation, you can feel free to call me. We can look into that. And in 2023, the Part B premium is going to be $164.90. So it's actually going down $5.20. So there is a penalty if you do not sign up for Part B in your initial enrollment period when you're first eligible for Part B, which is your medical insurance. If you don't have other medical coverage that's as good or better than what Medicare offers, there's a penalty associated. Every 12 months, you could have had Medicare coverage and had no other health coverage. There's a penalty of 10% of the premium for Part B. And that's cumulative, and it generally lasts for life. So I've had people that called me that went 10 years with no Part B because they didn't see a doctor, they didn't think they needed it, and they didn't want to pay the premium. So just be aware there is a penalty involved with that. And it does go up or go down based off of the Part B premium. So last year, when the Part B premium went up quite a bit to $170, anybody who had a penalty for Part B, it also went up because it's based off of the premium. And then there's Medicare Part D as well, which is your drug coverage. You can get this through a standalone drug plan, or you can get it through a Medicare Advantage plan. So there's a couple different options. This is the card you give when you go to the pharmacy. It helps pay for the prescriptions you need. Anyone who has Medicare can get a Part D. It is optional. You don't have to sign up, but there's a penalty if you don't. So if you don't sign up when you're first eligible for Part D, which is usually when you're first eligible for Medicare, there can be a penalty for that. So the late enrollment penalty for Part D is a little bit different. It goes from this first 63 days, so you get 63-day grace period. And after that, if you don't have Part D coverage or equivalent coverage for prescriptions that's as good as what Medicare offers, you get a 1% penalty for every month that you didn't have that coverage. And this is the 1% is based off of the average premium. So in 2022, it was about 33 cents a month. And that's again cumulative, and generally speaking, it lasts for life. The current projected amount for 2023 for the average of the Part Ds is going to be $32.08, and it is a decrease from 2022 of about 1.8%. And again, that's just the average for Part Ds. You may pay more for a Part D or less for a Part D, but that's the general average of what people pay. But it can be a little bit different. So this penalty, like we talked about, is 63 days or more with no credible drug coverage that's as good or better than what Medicare offers. And just want to let anybody know, if you have a penalty and you're not sure if it's accurate, you want to take a look at it, it is something you can appeal, and that's something I can help you with. So if you have a question about it, please feel free to call me, and I'm happy to go over it with you. I'm helping a couple people appeal a Part D and a Part B penalty right now. And the penalties are separate. So you can have penalties on both parts of Medicare if you did not get them when you were first eligible. And like we all know, I'm sure you have been bombarded with this. It's open enrollment for Medicare. I tell people I feel like this is like Christmas, and it's just coming, you're getting information about it earlier every year. I walked in August and there was some Christmas stuff out, and I was hearing about open enrollment in August. So it's every single year, October 15th to December 7th. And open enrollment is the time for anybody who has Medicare to make changes to their coverage. You can do all kinds of things during open enrollment. You can go from original Medicare, which is A and B, to a Medicare Advantage plan. You can change your Part Ds. You can change your Medicare Advantage plans. There's a lot of options. And just so you know, if you make multiple decisions during open enrollment, which I've had people do, Whatever the last thing that you had in effect on December 7th, that's what's going to go into effect January 1st. So I've had people who've changed their minds and enrolled in a different plan during open enrollment. That's fine. Just be aware, whatever the last thing you picked is, that's what's going to go into effect January 1st. And I did want to, Kate, take a quick second to let you know there's a lot of things to look out for during open enrollment. There's a lot of fraud that happens specifically during this time. So just be aware of it. Medicare Advantage plans are not allowed to contact you unless you contact them first. They cannot call you, they cannot mail you, they cannot solicit you. That's not something they're allowed to do. It's a marketing violation. So if you call that number on TV, just be aware, the one you've all seen with vision, dental, hearing, money back, calling that number opens that marketing door and they're allowed to contact you. I had a beneficiary who called that number on TV and they already had brokers calling them before they were even off the phone with the hotline on the TV. So just be aware, if you want information about Medicare Advantage plans, call Medicare, call me, call the plan directly, Blue Cross, Aetna. But if you call the number on TV, they are allowed to market to you after that. They're also not allowed to pressure you with false time limits. Sometimes I've had people tell me that a Medicare Advantage plan called them and told them that they didn't have until December 7th and they had to make a decision right then or they were going to lose their coverage. That is not true. Everyone has until December 7th. If you have any questions about that, feel free to call me, call Medicare. I'm happy to go through it with you. They're also not allowed to cherry pick. So they can't just pick healthy people to insure that are not going to cost them a lot of money in healthcare. They're not allowed to do that. They have to offer healthcare to a wide range of people with a wide range of health issues. So just be aware they can't only take you if you're healthy. They also can't bribe you to sign up for their plan. They can't offer you a free gift like an iPad or something like that. If you sign up, they're not allowed to do that. And they're not allowed to enroll you without your consent. This has actually happened. We've had multiple calls. I had somebody who was in Walmart. They saw a broker. They were at a table in May. They stopped to ask them questions, gave them their Medicare number just to get some information, said they weren't interested and went on their way. Well, they were enrolled in an Advantage plan without their knowledge. So in December, they called me and they'd been paying for a supplemental policy that whole time. Those don't work with a Medicare Advantage plan. So that was $150 a month they were lighting on fire because it did them no good. And their doctor wasn't in network because the broker didn't check. So just be aware that does happen. So just be careful about talking to people that are just out tabling in a grocery store or something. Be careful who you give your number to because it does happen where people get disenrolled or enrolled in a Medicare Advantage plan without their consent. So we're going to talk about the Medicare Savings Program, which is why we're all here. So this program can help you pay your Medicare premiums, which is why we wanted to talk to you a little bit about what those premiums are. So we'll go through the different levels and how they can assist you. So there's a few different levels of the Medicare Savings Program. The most generous income level is the qualifying individual level, the QI level. And that one, you can be an individual with $1,549 gross monthly income or couples $2,080. There is no asset limit for MSP, so they don't look at your assets. This level will pay for your Part B premium, which again, in 2022 is $170 a month. They pay for that. You can also get some retroactive reimbursement for Part B if you sign up 3 months retroactive coverage if you sign up and you've been paying that premium. Just be aware you absolutely cannot have both the QI level and Medicaid. You cannot have both. So just be aware of that. The next level, which is a little bit less generous in terms of income, is the specified low income Medicare beneficiary. This is commonly known as the SLIMB level. So individuals in this level, it's $1,379. For an individual, couples is $1,851. Again, no asset limit. And this will also pay for your Part B premium. And you can get the retroactive, but you can have SLIMB and Medicaid. So you can have both of those benefits. So the levels make a difference in terms of income, but also what they will allow you to do. So the next one is the qualified Medicare beneficiary level, also known as the QINB. This individual's is 1,153. For couples, it's 1,546. This will pay for your A and B premium. So if you have that Part A premium where you didn't have the working history, the 10 years, and you had to pay for Part A, this can help pay for that premium if you're in that situation. So just be aware. Also at this level, providers are not allowed to charge you co-pays, co-insurance, deductibles, things like that. So if you have this level and you're getting billed for services, for Medicare covered services, for original Medicare, please call me. They're not allowed to do that, and I will absolutely help you with that situation. You can also have this level and Medicaid. So you can have duplicates for that. So Medicaid is, just want to give you an idea about the income guidelines for that. In 2022, it's $954 for an individual. There is an asset test for Medicaid. So for individuals, the asset cap is $16,800. For couples, you can make up to $1,387 with an income cap of $24,600. So this has got a lot of health coverage options. You can have Medicare and Medicaid. So don't feel if you have Medicare, you can't have both. You can, if you qualify in terms of income. It offers additional health coverage for people. For services covered by Medicare and Medicaid, generally Medicare will pay first, and Medicaid might pick up all those other things like the co-insurance, the deductibles, things like that. Medicaid sometimes offers services that Medicare doesn't cover, like vision, dental, things like that. And you can also maybe qualify for that QINB level we talked about, which pays for your Part B premium. So this is absolutely something to look into. If you think that you might be eligible, please call us. We'd love to help you with it. Absolutely. Or contact your local Medicaid office or HRA. So there are some additional benefits to the Medicare Savings Program. You can sometimes enroll in Part B outside of your initial enrollment period. So if you miss that window, you have to wait till the general Part B enrollment period if you didn't sign up when you were first eligible. Which can be a long wait because it's January 1st to March 31st every year. So if it's say September, that's a long time to wait for coverage. So the Medicare Savings Program can sometimes allow you to sign up for Part B and not have to wait for that general enrollment period if you missed your initial window of when you could sign up. It can also eliminate your Part B late enrollment penalty if you have one. And you automatically get enrolled in the Extra Help Program, which we're going to talk about. That's for prescription savings. We're going to talk about that, which is a wonderful program. So just to go through really easily, it's very simple to do the application. It's something I can help you with. I believe Selena also said she could help you with it if she's there. Absolutely. So you just want to get the Medicare Savings Program application. I can send you one. I'll send it to Selena so she'll have it. So get the application, complete it. Be sure to answer all the questions. If you're married and living with your spouse, you have to complete both the self and spouse sections on the application, even if your spouse isn't applying. So just be aware of that. Be sure to read all the information, sign and date the application. If both of you are applying, if you're married, your spouse must sign the application as well. You want to gather and include all the verification documents and their equivalents. So I'm going to tell you what those are. You're going to need a photocopy of the front and back of your red, white, and blue Medicare card. You're going to need proof of your date of birth, proof of your residence, and the residence proof must be within 6 months of the application date. So it can't be residence proof from like 4 years ago. It has to be current resident. Proof of your income, and also proof of any other health insurance premium you pay besides Medicare Part B. And we're going to talk about why that is. And if you're not a U.S. citizen, just be aware you have to provide documents indicating your current immigration status when you're applying. So you want to have all of those. And if a spouse is applying, the spouse has to provide the information as well. So before you mail your application, be sure you've answered all the questions. Like we said, sign and date it, include your documentation. I strongly recommend you make a copy of everything for your records. Make a copy of everything you're sending, make a copy of the application, and also make a note of when you're sending it. What is the date that you're sending it? Where are you sending it to? So you have this for your records. Mail the application and all the required documentation to either your local social service office or your local HRA office. During COVID, not all the offices were open. So if you have any questions about where to send this, please call me. I can help you with HRA. I can also help you with your local social services. So please let me know and I'll happy to get you the place to send it to. They should send you a notice of action within 45 days of filing an application to let you know. If you are denied for some reason, please again, feel free to call me because that might be something I can help you with. You can appeal a denial to the MSP program. If you feel like you should have gotten it and you didn't, please know you can appeal that. I've helped people do it and we've been successful. So definitely please call me and I'm happy to do that with you. You do need to renew or recertify your MSP every year. You should get a notice in the mail to recertify. If you don't, please contact your local Medicaid or HRA office to discuss it with them because you should be getting that. You want to make sure you're getting your benefits for the following year. So the reason they want you to send proof of any kind of health insurance you're paying for besides Medicare Part B is because they are disregards. And what that means is that's money you can deduct from your income to help you qualify for MSP. So if you are over the income limit, but you pay a premium for a Medigap or other secondary health insurance, you can deduct that premium from your income. I had somebody who had a Medicare Advantage plan and half of the Medicare Advantage plan premium was health insurance. So we were able to deduct that. So this is this over here where the benefit was $44. The beneficiary was $44 over the Medicare Savings Program income gap, but they paid $45 a month for health insurance portion of a Medicare Advantage plan. So we were able to send evidence of that and they qualified and they were able to get the Medicare Savings Program, get all that Part B coverage for their premium. And it's a great program. Sometimes a portion of your Part D premium can be disregarded as well. Not the entire Part D because you will get help with your Part D premium, which is why you can't discount the whole thing. You can only go over a certain amount and I can discuss that with you in depth if you think that's something that you might be able to qualify for. Part B premium cannot be deducted from your income to qualify. So it's anything other than Part B. So supplementals, vision, dental, all that kind of stuff can be disregarded to help you qualify. So anyone who gets the Medicare Savings Program also gets the Extra Help Program. And this program is amazing. It helps with your prescription drug costs and it's really fantastic. It also gives you Part D premium assistance, which is why you can't deduct that from your income for the whole thing, because it will give you assistance of up to $42.43 in 2022. It's known as the benchmark. That changes year to year, but I can tell you what it will be for next year as soon as I have it. But it also caps your drug coverage. So you pay no more than $3.95 for generics and $9.85 for brand names if you have extra help. So it's a huge benefit for people who have high prescriptions amounts. So this is still subject to change for the benchmark. I don't think I have that information yet. We've been getting fast and furious with all the information for Medicare. So I haven't seen that one yet. So just be aware that might change. The 4243 will be different for 2023. So the Extra Help Program can actually be obtained two different ways. You can get it when you apply for MSP. Anybody who gets the Medicare Savings Program gets extra help, but you can also apply through Social Security. So sometimes if you talk to somebody, they may tell you to apply for extra help through Social Security, which is fine, but there's an asset test if you apply through Social Security. There is not an asset test when you apply through MSP. So just be aware that there's a difference between those two ways to apply. Like I said, if you get a Medicare Savings Program, it's automatic that you get extra help. So just be aware there is a difference in applying. So be careful where you're doing it through. The Extra Help Program, like we said, pays for your Part D premium up to the benchmark, which is again $42.43 in 2022. Lowers the cost of your prescription drugs, but it also gives you a special enrollment period. And what that means is that's time that you can change your Medicare coverage outside of open enrollment. So this is a really great benefit because you get one per calendar quarter if you have extra help. So that means that once a quarter, you can make a change to your Medicare coverage. The final quarter of the year, they consider just open enrollment. So that actually ends December 7th, that final quarter. It used to go all the way to the end of December, but they changed it. So if you have extra help, just be aware you have to make a change by December 7th in that last quarter, but otherwise you can make a change throughout the year, and it's one change every quarter. So that's really nice, because if you need to make a change to your coverage for a health reason, maybe a prescription, it's a long time to wait for open enrollment if you have to make that change, like say mid-year, because you have to wait for open enrollment and it doesn't start till January. So a special enrollment period lets you bypass that and get that coverage changed sooner, which is a really wonderful benefit. It also can eliminate your Part D enrollment penalty, like we talked about in the beginning. So if you have a penalty for not signing up for drug coverage when you first could, this can eliminate that Part D penalty. There is a full and partial extra help depending on income, but that's going to be changing in 2023. It'll just be extra help. But also remember that the extra help program is not a replacement for Part D. It's not insurance coverage. You have to have a Part D to receive prescription drug coverage and the extra help assistance. You have to have that Part D plan, either a standalone or through a Medicare Advantage plan, to get the assistance. So in 2024, the extra help income guidelines will be expanded. So people below the 150% of the federal poverty level can qualify. The federal poverty level changes from year to year, which is why I don't have a number for you. I only have a percentage because we don't know what that's going to be for 2024. So just be aware that that will be changing. Anybody who previously qualified for the partial subsidy, the partial extra help, will now just get full extra help, which means that you get more assistance for your prescription drugs. The asset limits for the full subsidy will continue to apply if you apply through Social Security. Again, if you apply through the Medicare Savings Program, there is no asset test. So just be aware of that. And this is really a great benefit, particularly for older persons of color, because they represent a disproportionate share of Medicare beneficiaries with low income. So this is a really great expansion that we are happy to see coming through. So there's also going to be some changes to the Medicare Savings Program in 2023. So we want to let you know about that too. So we worked with other organizations to get the Medicare Savings Program guidelines expanded. We heard from people just like you on our helpline who couldn't afford their medications. I have one beneficiary. They don't qualify for any other assistance program. They have one medication. It's $3,000 a month with insurance for one medication. They take 18 medications. So this income guideline expansion, they will now qualify and will be able to get that assistance with their drugs. So they'll be able to actually not just take the medications that keep them alive, but the medications that give them quality of life, which is just as important. You need to be able to take everything your doctor thinks you should and not be playing Russian roulette with your meds because you can't afford them. So this will help cover a lot more people. It's a really life-changing difference for people. So in 2022, I know I've given you a lot of information, so I just wanted to recap. In 2022, with no asset test, if you make $1,549 or less, you'd qualify for some level of MSP. If you were couples, it's $2,080 per month. Again, some level of MSP. But in 2023, the income gap is projected to be $2,107 for an individual. And couples, it's projected to be $2,839. So it's going to be a big difference in 2023. These numbers are projected because, again, they're based off the federal poverty level, which we do not have yet for 2023. But this is the projections that they released. So when I get that information, I'm happy to share it. I'm happy to send it to Selena to give to you. But always feel free to call us anytime, and we're happy to go over it with you and to help you with it. So just Medicaid really quick, I want to let you know, like we talked about, you can have Medicaid and Medicare. If you're new to Medicare and you are on Medicaid, you have to show proof you've applied for Medicare or you can lose your Medicaid benefits. No one was losing them during COVID. That's the standard rule, and it will go back into effect when the public health emergency ends. So if you know anybody who has Medicaid, they're getting ready for Medicare. If you do, please make sure you're letting Medicaid know you applied to Medicare when you're eligible. There was also a piece of legislation passed in 2022 called the Inflation Reduction Act, which resulted in expansions to Medicaid. So in 2022, there was an asset test for Medicaid. So if you had $954 per month as an individual with an income limit, or sorry, an asset limit of $6,800, for couples, $1,387 per month with $24,600 asset limit, you would qualify for Medicaid. But in 2023, they're going to expand that quite a bit. So the individuals will be $1,563 you would qualify if you have an asset cap less than $26,134. And for couples, it's going to go up to $2,106 per month with an asset of $37,908. That's a big increase, and that's going to help a lot of people. Again, projected because it's based off the federal poverty levels, but we're really excited for this change because there's a lot of people who really need the assistance, who really just can't afford their health costs. When you're on a fixed income, $5 might as well be 5 million. So this will be a big difference for people and really help. Also, please be aware that if you do not think you qualify for Medicaid, there are options. There's something called a pooled trust, which can help you qualify. They can help you manage your finances so that you can disregard more things to qualify for Medicaid. So there are options. If you don't think you qualify, please call me. I'd love to talk to you about it. We'll talk about all the different options that you might be able to qualify. Also for the Medicare savings program, that you might qualify. If you don't think you do, please, I'll go through it with you. I'll do all the math with you, and we'll figure out if you do qualify and help you apply. I do also want to tell you a quick thing about medical debt. We've been hearing some of this on our helpline, so we really want to get some information from people in the community like you. So we're working to educate the public of your rights when you're facing Medicaid or medical costs that you can't afford, but we really want to hear your stories. Hospitals should absolutely be explaining of you how to get assistance paying your bills if you have hospital bills coming that you can't afford. They should be talking to you about that, and we really want to hear your stories. If you have any kind of hospital bill, ambulance bill, anything like that that you can't afford that you're getting, please call me. I'd love to hear your story and talk to you about it. Really choose your health insurance carefully. Make sure you really understand your obligations like deductibles, co-insurances, co-pays. Again, you can call us for free, unbiased, individualized counseling. I'll put in your medications so you know your actual costs for your health needs. Check your insurance, your explanation of benefits, and your Medicare summary notice. Those are the summaries you get in the mail from Medicare and your Medicare Advantage plan. They're not bills, they're just summaries of services. That's a great place to check for billing errors. So definitely look over that. Be aware you can appeal your bills if you have medical bills that are coming through, and you can get help navigating that. You can call us, you can call the community health advocates at 1-888-614-5400 to help with negotiating that. Please share your story. We'd love to hear from you. We really want to work towards making sure our healthcare is working for everybody, with us and for us, so that we can have better healthcare and coverage. And our helpline for all of the programs I've talked to you about today that Statewide does is 1-800-333-4374. We have counselors in New York City, Buffalo, Albany, and I'm in the upstate region. So anywhere in New York State, if you call that number, you will get a trained counselor who will help you with your situation. If you have any general questions, feel free to call. I'll connect you with a resource if it isn't me. I'm never going to hang up and say I don't do that. Never going to happen. I'm going to get you to somebody who does do what you need, or I'll get you the information if I don't know it. So I'd much rather have you call me and talk to me so I can help you. Does anybody, we talked about a lot. This is the 1-800 number, and my email here is Sarah, S-A-R-A-H, at nysenior.org. So you feel free to email me anytime. And our website is www.nysenior.org. So we have a lot of great information up. And if anybody wants to reach out to me, feel free anytime. So I guess we'll just see if anybody has any questions they want to ask. We gave you a lot of information today.
Wow, Sarah.
It's a lot of information, I know.
That was a lot, but it was really good information. I just want to emphasize again, 2023, there's going to be quite a bit of increase to qualify for Medicare savings program. So if a lot of the members tend to be living alone, they may not have their partner. If you're an individual, if your income is less than 2,107, each month, then you probably qualify for the Medicare Savings Program. I know it was 1,549 all the way up to this year, but I mean, that's almost a $558 increase. So again, come to me. Sarah is also available. Medicaid.
Absolutely.
I know a lot of people say they don't qualify for Medicaid. If your income is less than $1,563 for 2023, you qualify. But also, it really Medicaid, you can get Medicaid with your income, no matter what your income is. So either talk to me, talk to Sarah. This is
Absolutely.
really good information. Again, Medicare Savings Program. Everyone sign up. It's very easy to fill out. I have the application. Sarah will send it to me as well.
Absolutely.
We'd like to take some questions. We have about another 10, 15 minutes. Anybody?
There's a lot of information, I know.
Or recap. Again, we are recording it. I could send it to
Absolutely.
you. And also come and speak to me as well.
Yeah, and I'm always happy to go through it with you individually. And like we said, there are disregards. So even if you're at that income cap, you're a little bit above, there might be ways to get you to qualify for the Medicare Savings Program as well. So definitely feel free to call. It's better to check and get the benefit if you can, because it gives you a lot of great benefits with helping with that Part B premium. And again, the extra help program and just getting that ability to change your coverage once a quarter is really nice.
Okay.
And we all know that medications can be exorbitantly expensive, even with insurance.
Right.
Is
there any questions? Or she was so thorough. And you
it's so much. I know it's overwhelming. It's a lot.
I have a question.
Yes, go ahead.
Hi.
Hi. Nice to see you.
Hi. Yes. This was so helpful.
Good.
My question is, through my pharmacy in the north of Riverdale, they were offering us the Epic application, and then they I guess scanned it in, for us last week or whatever. Is that, how is that connected with this?
Absolutely. Epic is a separate program. My colleague Jean, I believe, is actually coming to present on Epic next week to talk to you about all the things. But the Epic program is a great program. It is much more generous with income guidelines. Epic is $75,000 for an individual or $100,000 for a married couple. So it's just got a much more generous guideline. But Epic does help cap your medication costs. It's separate from MSP. But I know Gene's going to be here next week, and he's going to do a whole presentation just on Epic to tell you about it. He worked for Epic for 10 years. So Gene is the man to answer your questions, because he worked there. He loved it. And then we were lucky enough to snag him to help us. So.
So one more question. So if I applied for Epic without knowing about this Medicare Savings Program, can I still apply for the Medicare Savings Program?
Yeah, absolutely. Give me a call and we'll talk about it.
I
Absolutely.
will. Thank you.
About the Epic, because yeah, definitely feel free to call me. I'll put my direct number right in the chat for everybody. You can call the 1-800 number, but if you want to call me directly, I'm putting it in there right now. My direct line is 607-319-4888. That calls right to me. If you don't get me for any, leave a message and I will call you back. I promise.
Okay. And again, this is going to be recorded, and we'll have that available for anybody who missed part or some of it. Okay. Any other questions, comments?
I have a question.
Sure. Hi, Helen.
Hi.
Okay.
If the Republicans win the midterms and God forbid the presidential election, will this stuff possibly be in danger? These increases?
Yeah, absolutely. I don't believe that would change it. Certainly not initially. I don't believe that it would change it. Because the IRA, Inflation Reduction Act, was the part that expanded Medicaid, which was passed this year. So that was passed and put into place. So I don't believe that would change that, at least, especially not initially, but I don't believe it's in danger. I will just double check to see if there's anything in their agenda, if they were to be elected, that they're looking to change any of this, if that would be something that they could do. I'll double check it, but I don't think it would be in danger, even with a change of the guard, so to speak.
Okay, thank you.
You're welcome.
Any other questions or comments? Wow, Sarah, you're very good.
Excellent. And if you just want to call me because you have a question, but you don't want to go over it, feel free anytime. I love to talk to people. So
Right. Oh, may I ask the statewide, the helpline? Is there other languages that someone, if it's Spanish speaking, Chinese, Korean?
we
whatever?
do have language interpreter system that we use if somebody calls on the phone and English is not their first language and would prefer another language. We do have interpretation services, and our information is available in other languages. So if you know somebody who doesn't speak English and you want to see if any of the information we have on Medicare fraud, patient rights, anything like that is available in another language, definitely let me know, because I'll look into it. And if it's not, we'll look into getting it translated into that language for you for the printed material as well.
Okay. Any other questions? Okay. Dean is saying that these sessions, these series have been wonderful. So we really appreciate that.
Absolutely.
Again, yes, we have it
Yeah.
every Tuesday at 10 o'clock from 10 to 11, all the way to December 20th, actually.
Yeah. My friend Leslie came last week. She's in the New York City area. So if you call the hotline, you're going to get my friend Leslie. She's amazing. And Gene next week is in the Albany area. And he's the Epic expert. So he'll be here next week for that.
Wonderful. Let's see, Maritza in the center. Does anybody have any questions? I know it's muted. That's why. Anybody in the center? Okay, she left. All right, so she can't unmute anybody. So, okay. All right, I'm just wondering in the center if somebody had a question, but we needed to have it unmuted. Okay. All right, I'm sure anybody in the center, if you, Lowell, hi, do you know how to unmute? Okay, I guess Lowell has a question, but we can't unmute it. I'm just thinking that if anybody has a question or comment in the center, if we can't unmute right now, you could ask me the question and I'll ask Sarah and we'll get back to you.
Absolutely.
Yeah, I know Lowell's trying to communicate, but you're on, let's see. Oh gosh. If anybody, any staff is there. Let's see. Hold on. Maybe Lowell could figure it out. Ah, there we go, Lowell.
Okay. Thank you.
The general question is, you, Selena, will have copy of this material available for people who are sitting here today.
Absolutely. So you could come and just come directly to me and come
I
to
can
my
also
office.
send you a PDF of the presentation if anybody wants to just be able to review the presentation itself as well.
Wonderful. Thank you.
Thank
Okay.
you so much. And definitely come next week, listen to Gene because he is amazing and he's got all the Epic answers.
Again, Epic is a really good benefit to have. Everyone should take advantage of it. So please come.
And it's much more generous with income. So absolutely, it's a great program.
Great. Thank you so much, everyone. Sarah, you are wonderful. We look forward. I think you're coming back on December 20th.
In December, yes.
Yes, so wonderful.
Yes.
Again, you know, we'll get all that information and everyone have a wonderful day. We'll see you next week, all about Epic at 10 o'clock. Thank you
so much, everyone.
Bye-bye.
Yeah.
Okay. All right, wonderful. G-O-N-E-O.